how do you collaborate with other specialists like speech or occupational therapists? Because that must be a big part of this.
Yeah, it's really important, especially these kids that are more complex. And let's face it, we get a lot of the really complex kids because they've kind of failed everything else, you know? So a lot of times they've got a lot of specialists they work with. So one of the first thing is when I first do the brain scan and I work on that report, I'm getting a list of who are you working with and try to get a release of information so that I can, communicate with them. And then also we'll share the report findings. We'll invite them to the results session, so they can collaborate and we can kind of, team up. I was working with one childhood psychiatrist, and based on some of the things we saw going on, that we could tell that there's metabolic things going on with the kids, and we did a little consultation, and we got from some of the things we're seeing, it was meeting some profiles with other kids that had like PANS and PANDAS. And so we talked to the doctor. They ended up going and like looking into that and treating the kid for that, and it just revolutionized his treatment. I mean, we were doing some neurotherapy that was helping him, but it wasn't, there was something else that still needed to go, and really kind of honing in and kind of seeing some signs and then asking the doctors to kind of follow up on that was really targeting that was the real source of the issue for the kid. And when that got targeted, he graduated neurotherapy and he was doing so much better. So we definitely want to collaborate with the other providers out there.